I travel 4 days a week, it's best to contact your brokers, and you definitely have some of the best in the business here at NCW. But if they don't know the answer, they usually will call me. So if you need to email me or call. Also, if you want to follow me on Twitter or Facebook, I tweet a lot. If you don't know what tweeting is, it's not that big of a deal. Don't go learn a new trick. It's not that fun. If you have any questions today, please stop and ask me anything you want to. You are my 80th presentation, and I always say I think I've heard it all, but someone always brings up a really good point. So do not hesitate to ask me anything you want. First things first is you guys know that there's a lot of regulation that is coming down the pipeline, mainly from the IRS, Department of Labor, HHS, and a new company or an entity called CCIO, C-C-I-I-O. If you're a large employer, you must know what CCIO is, because one of the most important calculators that's going to be useful for you is located at CCIO's website. I don't know how anyone can do business in health reform world without a computer these days. So if you don't have one, you might want to think about getting them. I think they're going to catch on, these computers. So you might want to make sure that you know how to access all of these different individual websites. And I have links to all of the issues I'm going to talk about at the very end of your packet, as well as there's some notes pages, some blank notes pages that you can take. Before we get into kind of the meat and potatoes of what I want to discuss today, I want to make sure to explain to everyone that there has been some developments in Washington, D.C. about Ted Cruz. How's the volume back there? Can you hear me okay? All right. Ted Cruz did some people are calling it a filibuster. Wasn't a true filibuster because he couldn't stop anything. Kim earlier mentioned that some of the health reform may now be tied to the debt ceiling vote in 7 or 8 days. I think that particular tactic has some legs. It seems to me that if anything, we will see at that point the debt limit vote be tied to some kind of Obamacare, not repealed, not replaced, but possibly delay. If it delays anything, it will probably be the individual mandate. That's saying that every U.S. citizen and legal resident in our country must now purchase a qualified health plan. That's really the kind of the silver lining that I see possibly coming out of Washington, D.C. It's going to take Democrat and Republican support in order to make that happen. So who knows? Just keep watching your news, and every week we get new developments. I was just checking my email before this presentation, because often, as Kim says, whatever I said in the morning can change by the afternoon session. Luckily, that didn't happen today. They didn't put out regs on Friday afternoon either, so I'm starting to get a little suspicious of what the government's actually doing up there in Washington, D.C. As you know, everyone will now be required to cover or have health insurance in our country. One of the mandates that was repealed on July 2nd was the employer mandate, saying now you have another year in order to comply with the law. Many of you have not renewed your health plan yet. You will January 1st. How many of you have a January 1st renewal date? Seems to be like the most popular renewal date for large employers. Not much is going to happen to you guys in the way of January 1st. You should be getting your rate packages on or around October 1st, and you'll be able to see what your rate increase looks like. For the large employers, seeing what I'm anticipating for most of you is about a 15% rate increase in general. And some of that is tied to the taxes that you're going to be charged. I'm going to tell you that there's at least 6 new taxes that were introduced under the health reform law. I'm going to give you some examples in your packet. There's 3 prime examples. Anybody self-funded in the room? Excellent. So being self-funded, did you already turn in your PCORI fees as of July 31st? Great. That's one of the taxes, the dollar a head, that will be required to be paid by self-funded plans. It was required by July 31st. Most people knew that if they were self-funded. Many times the TPA or the carrier having to do with self-funded plans prompted those employer groups to stay focused and make sure they're turning on their taxes on time. Reinsurance assessment impacts everyone as well. It's $63 a head. Also, there's a health insurance industry fee. Currently, this fee is between 2 and 2.5%. What we're seeing, at least with some evidence in the small group market, is about a 3.55%. I'm sorry, yeah, 3.55% total a cumulative tax for those groups. Now, large group is a little bit different. We don't have as much data on you guys because, you know, everyone's kind of shoved it under the carpet at this point. But I would anticipate seeing large group somewhere in that category as well. So be looking for about, you know, without trend, at least 3.5%, 4% in taxes alone. The thing I want to make sure to point out to you guys is that these taxes are the carrier's responsibility. So if you're insured by Blue Cross Humana United, they are assessing tax. But what they've done is they've instead passed it on to you. You will probably pass on the cost of health care onto your customers as well. We're going to talk about that here in just a few minutes. Everybody in this room knows for sure that they're a large employer, right? More than 50 full-time equivalents. Is that true? Great. We're going to skip everything having to do with small groups. Now, if you have 52 employees and you're thinking about going home and firing some people, in your packet there is a ton of small group information in there. I will tell you that if that is your strategy, you might be missing the mark. I actually think that large employers are going to fare much better, at least for the first 2 years, when it comes to rates, plan designs, rating, and carriers. You guys are in the best possible situation. You're not going to see a huge rate spike. You're going to have very stable plan designs, at least for the first year. Now, once 2015 hits, your business decisions might be changing. And we're going to talk about what business decisions you are going to be faced with here. If there's one slide I would laminate out of all of them that you have, it's this one. Some of you are going to go home today and you might fire people to be small. You might hire people to stay large. You might also think about self-funding, which I believe self-funding is key to health reform in the future. The other thing I want to make sure to tell you is that you are only defined as a small employer, 2 to 50 until year 2016. In year 2016, if you are 2 to 100, you are a small employer. That means if you have between 51 and 100 lives in the year 2016, you will be lumped in with those small employer plans and requirements. So if you are a mid-market employer now, keep in mind that your entire world shifts in 2016. That means you must know what community rating looks like. You must know what guaranteed issue and essential health benefits look like. You must know that you will have plan design limitations placed on you if you have between 51 and 100 lives. 2016 sounds like a really, really long time away. But if the federal government's telling you for 2014 you can do whatever you want, and then for 2015 you're a large employer, and 2016 you're a small employer, you are going to have incredible amounts of change, not only in your rates, but your plan designs as well, and the way you do business. You need to plan for that in the long term. Now, if you have more than 100 employees, you don't really care because you're going to be a large employer. But if you're in that mid-market sweet spot, you might want to really start thinking about a 3-year plan versus just a 2-year plan for you guys. Every yes on this chart equals a dollar amount. So what you can see just from looking at the key provisions of health reform is deductibles, guaranteed issue, essential health benefits. All of those benefits that apply mainly to both individual and small group plans are going to be more expensive. Large group get out of several health reform issues. Now, what you don't get out of is a pay or play, or employer responsibility is what the government calls it. Tax, fine, penalty, whatever you want to call it. We're going to go through all of those in today's presentation. There's something that's immediately necessary for you to do. Who has heard of the model notice for the marketplace? How many of you have sent it out? How many of you have no idea what I'm talking about? Okay, that's good. You're going to learn something for sure. Effective October 1st, every employer must send out a notice that tells your employees in one of two ways. Either you do offer benefits or you do not offer benefits, health insurance benefits to your employees. I'm going to give you some tips and tricks just in case you haven't filled it out yet. Now, the marketplace notice is due by October 1st. You can give it to your employees in several different ways. You can staple it to everyone's paycheck. You can have a meeting such as this, making it mandatory that everyone attend and hand them a copy. You can mail it to them. You can email it to them with a read receipt. What you cannot do is sit it on the break room table and expect that everyone received it. So you need to make sure that you're following the letter of the law. Let me give you some more tips. This is actually what the form looks like, and there's a copy in your packet, I think. I change this thing up every day, so I don't know when the last time I updated and sent it to Elizabeth was. This form says that I do offer health insurance to my employees. There are 3 pages to this form. Only page 1 is required. If you have sent out already the model notice and send page 2 and 3, it's fine. You don't have to do those things, but it's okay. So page 1 simply states the only part that you have to fill out is who do your employees contact for more information on their health insurance. It really is that simple. Now some employers are a little skittish about just putting out page 1, and so they go on and fill out page 2. I'm still okay with the blue shaded area atop page 2 because it's pretty basic information. Name, address, phone number, and so on. You're going to get that information, no problem. Question 1 is also pretty easy. Do you offer insurance to all of your employees or some of your employees? You make a choice there. The next question, with respect to dependents, do you offer it to all dependents? The last question, however, is one that could trip you up. The last question specifically says, if checked, this coverage meets minimum value standard and the cost of this coverage to you is intended to be affordable based on employee wages. A lot of gotchas in that sentence. Who knows for an absolute fact that you have a minimum value plan that meets affordability today? We got one person, 2 people in this room who say yes, absolutely. If you check that box and you are not 100% certain, this year you're okay. You have no penalties. But next year, if you are going to be expected to check this same box, which we think this is just a one-time model notice, except for new hires. New hires must be given this form within 14 days of hire. So put this in your new hire packet. Let me give you a little tip. This form actually expires. Look up here in the right-hand corner. This form actually expires November 30th of this year. So you need to be watching the Department of Labor website for an updated form, updated instructions. I highly suspect that they are going to dramatically change this form. So after December 1st, when your new hires come on, please make sure that you have the most up-to-date form. And I'm sure your brokers will help you when the new form comes out. Now, page 3 is completely optional. Please don't fill it out. There's no reason to fill it out. The other question I get many, many times is, where in the government do I send this form? There is no requirement to send this form to anyone except your employee. So your employee has a piece of paper that he was mailed or emailed or given to his paycheck, and it goes no further than that. There is no check, no balance, no record-keeping requirement from the federal government at all. So whether or not you checked any of these boxes really is non-detectable by the federal government. Now, this particular form is supposed to let your employees know that you offer a minimum value affordable plan, therefore they cannot go to the marketplace and receive a subsidy from the federal government. That's what this form is intended to do. If you don't offer an affordable plan at a minimum value, your employees and their dependents then can go to the marketplace and receive a subsidy. Now, to make sure you all understand, there's a huge difference between the two. If you offer affordable coverage at a minimum value, you block your employee and their entire family from receiving a subsidy from the federal government. If you offer a minimum value affordable plan, if you do not offer a minimum value affordable plan, they can all go to the government and purchase a subsidized plan if they want to do that. So it's very important that you as an employer know which kind of plan design that you are offering. Sir, did you have a question?
Yeah, if I elect not to use the DL form, but I do clearly articulate all the minimum requirements and notification, I'm still good, correct?
Absolutely. This is a model notice. You do not have to use it. I've seen many forms come up that people have done themselves, and they're much easier to understand, actually.
Yes.
Any other questions about the model notice? It's due Tuesday, so if you have not done it, you might want to think about doing it. There is one more thing I want to tell you. There are no fines associated if you do not do this form. The IRS made very clear in an FAQ last week that there is no fine associated with not completing this form. Now, I do not recommend that you skip over it. I still think sending page 1 is a reasonable request, but you won't be penalized if you don't do it. Basically, you're going to be advertising to your employees that the marketplace is coming and open on October 1st. Of course, you can't tell them anything about it because you don't know the rates, the plan designs, or the carriers, so you're not really telling them much. In addition, waiting periods. The delay of the employer mandate did not stop the waiting periods. And I'm sorry that you guys have to skip around a lot in your packet, but everything's kind of changed. It's in there, I promise. It's near, so probably halfway through. Everything you're skipping over is small group related. So if you're going to go home and fire people, you might want to review that stuff. 90 days is your waiting period. Every carrier that I know of, all the big boys, are going to allow you to have a mid-month effective date. You want to have an 82-day waiting period and it happens to fall on the 17th of the month, your carrier will prorate those premiums for you. No problem. So here's a little cartoon to kind of jazz things up for just a second. It really is a major delay in health reform. It also is a major delay in collection of taxes that we need to pay for when it comes to subsidies. There are still a lot of things that you need to know. Number one is this measurement period. And this will impact some of you effective January 1st of 2014. For some of you who have companies with high turnover, you may run a retail shop or a restaurant chain, you probably want as long of a measurement period as humanly possible, which is 12 months. That means your clock starts ticking for a lot of you on January 1st of 2014. You would need to start tracking your variable hour employees on 1/1/14, so you have a full year's worth of data on those people. Now, some of you are not going to have a 12-month measurement period, and I totally understand that. Some people are going to do 6 months. I've heard some brokers and consultants always recommend a 6-month measurement period. I'm not going to tell you that a 6-month measurement period is good for everyone, because I don't believe it is. I believe for some industries, you're going to want a very long measurement period. The other thing to remember is that these measurement periods go on and on and on. It is not on January 1st of every year, I'm going to measure everybody. That's not how it works. You don't just hire employees one time a year. You hire them throughout the year. So when you hire Joe Blow, you have to decide, okay, he's a part-time employee, he is working some variable hours for me, my measurement period is 12 months, so I'm going to measure the amount of hours he works for me for an entire 12 months. And if that average is more than 30 hours a week, then the light bulb goes off and says, okay, now I have to offer him health insurance. So the first step is to pick a measurement period for your company. It can be anywhere from 3 months to 12 months. Next, once you determine that you may have an employee who's eligible for coverage, you have to administer the plan to him or enroll him in the plan. Now, I believe that something very easy to do is your administrative period should mimic your new hire waiting period. So if you have a first of the month following 60-day new hire period, you would probably have the same administrative period. That way you've measured them, you determine he or she does work more than 30 hours a week. You know they're going to bring them on the plan first of the month following 60 days. Pretty easy to administer. Well now, how long do you keep them on your health plan? Here's the tricky part. It's based on the longer of 6 months or your measurement period. So if you truly had a 12-month measurement period, you would keep that person, that variable hour employee, on your health plan for a full 12 months, regardless of the number of hours they actually work for you. So even if they fall down below 30 hours, they're going to have to stay on your health plan. One of the things I'm seeing is some technology that's helping companies, large companies, manage these variable hour employees. There's one really good company that will actually tie into your payroll and will notify you when someone's eligible in an administrative period and when they're supposed to come off the health plan. So we're seeing some technology solutions for you in that. If you don't purchase that kind of plan, you might want to look and talk to your payroll company because they probably will also be developing reports and tools for you to use when it comes to kind of measuring some of these people, some of these variable hour people. The other thing you have to be aware of as a large employer is breaking employment. Breaking in employment is a tricky situation. Sometimes someone breaks employment with you and they have come up with some rules based on this. So if you have someone hired and they leave your employment, if they leave for 4 weeks or less before you rehire them, then you bring them back onto your health plan as if there were no break in coverage. So it's continuous coverage for those folks. If they have more than a 26-week break and you rehire them, then you have to rehire them. They start all over again from the very beginning. Now, if you have someone who you rehire between 4 and 26 weeks, the rule of parity kicks in, which says how long did they work for you? If they work for you longer than they were away, then they come on your health plan with continuous employment. So keep your eye on these break in employment rules, especially if you tend to have people who leave your employment and you rehire them back. I know that in the oil field that seems to be a pretty popular concept. I'm learning all kinds of things about the oil field when I come out to these areas. Any questions in break in employment? All right, commonly owned companies and 1099s. We talked about 1099s a lot. You heard at the spring seminar, but 1099s are getting the heat's getting turned up on them quite a bit from the Department of Labor and IRS. We are seeing an influx of companies stop W-2ing employees and instead make them 1099s. I want to make sure you know the rule of the 1099 according to the IRS, and the basics of it is that if you give someone tools to do their job or tell them when to show up, they may not be a 1099 employee. So if that's something that you're doing, you might want to rethink that. You might want to go to the IRS website and really focus in on what those IRS rules are for 1099s, because that can be a pretty costly mistake. If you think you're a small employer but you have 50 1099s that are truly not 1099s, then at that point you could see some pretty hefty tax fines and penalties. Common ownership is another one that's getting a lot of attention as well. If you have a common control group or a control group that you may own, say 75% of, and you also own 4 other companies that you own more than 50% of, you're probably going to have to pull those companies together for pay or play purposes. So while you may have 5 separate companies with less than 50 employees, when you pull them together under common ownership, then you may see a company larger than 50, and then you must pay or play instead of offering small group benefits. Now, one of the things you can do through recent guidance is you can do different things for all 5 of your companies. So if you have one that's a cleaners that only has 10 employees, you could offer one level of benefit to them. And maybe if you have a car dealership with 40 employees, you can do something different for them. So you don't have to offer the same health plan to every company that you own, but you must offer benefits or pay the penalty on some of those employees. Is there questions about common ownership?
Is that gonna cause a discrimination issue where you offer 2 different types of plans to us?
Not at this point. Not, because 105H has not been defined yet. And as long as you're offering a minimum value to every company, which you probably would, then you'd be okay. So no discrimination as of today. But 105H comes out, and that's going to be a game changer for a lot of us.
But you would caution to have 2 different types of plans within the same ownership group of one company.
I would would say if you had one company that was all salaried, high comped, and you had one company that was a bunch of janitors, and you gave them the worst plan you could pay for, you might have a problem there. Yes. So let's get down into the dirty nitty-gritty of what you guys have to do. Large employers have to do two things. Well, I got a lot more than two, but major two provisions to stay out of the penalty is you must offer a minimum value plan. Most of you offer a minimum value plan today, you just have no idea that you're actually doing it. If you want to find out if you are offering a minimum value plan, in your packet, there's a calculator from Socio. Now, it's an Excel spreadsheet, and it's pretty difficult to maneuver. Even I'm pretty good at Excel, and I speak insurance, and I still have some trouble with sometimes with these calculators. Here's a tip for you guys if you want to go and look at this calculator, is that if you will just put in your deductible, your co-insurance, and your out-of-pocket max, and you hit the submit button at the bottom, that's going to give you a pretty good idea what your minimum value is. The number you're looking for is 58, because the law says you must offer a 60% bronze plan, but you can have a 2% differential on either side. So if your plan is a 58% minimum value, you absolutely can skate by with that. Now, what does this actually mean to you and your employees? Many people say it's a 60% co-insurance. That's not quite accurate. What it means is that the health plan will pay 60% of the overall cost of that employee's care. You can go about this in many, many, many different ways. I want you to think now about all the different ways that you maneuver your health plan in order to either save money or offer more rich benefits. Think about your prescription drug card. Think about your deductible. Some of you have gone to a $5,000 HSA with no first dollar coverage at all, except maybe preventive care, and then after that the health plan kicks in at 100%. We are going to see very creative plan designs come in that still meet minimum value. Now, some of you are going to offer a absolute 60% bronze level bare bones plan, and then you're going to have your employees give the opportunity to buy up. Many of you will probably not do this in 2014, but you will plan for it in 2015 when all of this really kicks in. It's a good idea to start thinking about some of these different options that you're going to have for 2015, because you certainly want to avoid the penalty. Now, right now, carriers are not telling you, okay, this Blue Cross plan is a bronze plan, or this Blue Cross plan is a gold plan. They're not coming out and telling you any of that information today, but eventually they will. When I see small group information released over the last 2 weeks or so, I see them broken into categories. And the categories obviously match the metal levels where it's pretty easy for you to understand. The message I want to make sure to give you is that not one of you has a minimum 60% plan as your star plan. If I came to you as a broker and said, I want to sell you this $5,000 deductible plan, and it has 60% co-insurance and it has no out-of-network benefits, you would look at me like I was crazy. Because you would say that's not insurance at all. It means I got to pay the first $5,000 and I got to pay 40% of the claim? Really? That doesn't sound like a good deal. Now, how much are you going to charge me for that? So we have to offer a very bare bones limited amount, but you will probably offer stepped up amounts too, all the way up to a platinum plan. That's a 90% plan. The second thing that you guys have probably been hammered to death with is this affordable coverage option. Now, I say it's an option because if you don't want to have affordable coverage, you don't have to. You would just pay a penalty if you didn't want to do that. If you do want to offer affordable coverage, there are 3 safe harbors for you to do it. I'm sure you're all very familiar as large employers who are on the ball thinking about this, what those are. Some of you have already probably selected a affordable coverage safe harbor to use in your company. The things I see happening in the marketplace in Texas right now is the number one, the Box 1 W-2. I see many employers going with that. And then the last one is the federal poverty level. Now, employers who have generally more money are going with the federal poverty level because they want to spread the $88.43 a month per employee, and they can afford to absorb the rest of the premiums for those employees only. The other trend I see with large companies across Texas is dropping spouse coverage. Now, one of the things I want to caution you on is if you choose to drop spouse coverage, that is completely within the limits of the law. But when you do that, that spouse can go to the marketplace and receive a subsidy. Because, well, if the spouse has no other way to get health insurance. I'm seeing mainly the super large companies drop spouse coverage, or at least say we will not cover a spouse if that spouse is offered coverage anywhere else. So think about your open enrollment periods. That's an extra conversation that you're going to have with every married person in your group. You're going to have to ask them to provide proof that you have insurance somewhere else if you exclude spouse coverage. Now remember, you cannot exclude dependents up to age 26. They still will have to be offered coverage, but you don't have to pay for them. Now in addition, you only have to make affordable the employee-only premium. So if you make the employee-only premium affordable to that employee based on their salary, then you're going to stay out of the penalty box and writing checks if you in fact make sure that just for that employee only, the coverage is affordable. Anyone have any issues or questions or anything interesting they've seen on the safe harbor benefits or affordable coverage?
Not interesting. I have a question. I thought earlier you said that if we offered an affordable plan, that it blocked the rest of the family from the exchange. But then you just said that the spouse could go to the exchange. What did I miss?
If you exclude spouse coverage from your large group plan, and then if that spouse has no other way to get health insurance, like they don't work, then they could go and receive a subsidy from the federal government. Only if you omit spouse coverage from your large group plan or self-funded plan can that happen.
Right. And ACA doesn't require you to cover spouse, but my question is along that, even if the spouse receives a premium credit, I'm not subject to penalty because he or she's not my employer.
Correct. And the spouse who is, if you omit spouse coverage on your large group health plan, the spouse is accepted to the marketplace based on household income. So they can require, even if the spouse works part-time, it still doesn't receive any benefits based on the household income. They may or may not qualify for the subsidy.
Right. But reiterating, the employer is not subject to penalty.
Correct.
You don't have to pay any part of the spousal insurance. You said it has to be there for them to get, right?
No, ma'am. Large employers do not have to offer spouse coverage at all, period. You can have employee,
If we offer it, but the employee is charged the difference in the premium,
Yes,
then they cannot go to the marketplace and get insurance, right?
correct. If the employee only is affordable, you block the whole family.
Okay.
That's also true of small groups, by the way. So what does this look like in the real world? What are you paying your folks? If you look at someone making minimum wage, $7.85 an hour, and you use the per hour method, you're really looking at about $130 a month with no pre-tax deductions for that particular person's premium. Notice I'm not saying anything about what the dependents cost, because a dependent can cost $1,000 a month and you don't care. There is no penalty assessed on that part. So you want to look at whatever the employee makes. Look all the way up to almost $21 an hour. That's $345 per month that you can use to pay for premiums for that employee only. So by now, I'm sure you are all savvy large employers. You know that the penalty is $2,000 per head minus the first $30 if you do nothing. And I'm sure now, as savvy large employers, you have an Excel spreadsheet looking at what you pay in premiums today versus what the penalty would be in 2015. Anybody see any exciting information when you do the spreadsheet and you look at the math? Is it cheaper to provide health insurance and cheaper to pay the penalty? Anyone do the math? Did everyone have a martini lunch and you're falling asleep? Many employers on the large group side tell me that the penalty is far less than providing health insurance. And yet I see no massive movement in the state of Texas to cancel large group plans. I see large employers getting more creative when it comes to offering health insurance, and I'm going to talk to you about some of those issues near the end. but I do not see a mass exodus for large employers when it comes to offering their health insurance. So you're doing other creative things like reducing work hours. We're going to talk about that too. There also is a penalty if you offer affordable coverage, unaffordable coverage as well, or you mess up on your variable hour employees. There's also a 100 per day penalty, kind of as a crumb catcher, I call it, in health reform. And this $100 penalty per day is if you do something wrong. So if you are assessing more than a 90-day waiting period for your employees, if you didn't issue an SPD correctly, if you didn't have an open enrollment period that met the federal guidelines, you too could be fined that $100 per day per occurrence. So if you're doing a bunch of things wrong a day, you could be fined pretty hefty fines. I think the limit for a large employer is $500,000 in a calendar year. And they're going to need the money, so make sure you're getting everything done correctly. There are two new forms that have been created, 6056 and 6055. I point these forms out and kind of give you some information to the IRS because I think this is where all the teeth comes from for the IRS to come and penalize you. This is the check and balance mechanism that you need to have in order to see if people truly do qualify for subsidies inside the marketplace or if they don't. Remember that during the first year, it's simply a self-attestation that yes, I make $20,000 annually and I need a subsidy for my health insurance. Now there is one tiny check, and that is if you filed your income tax return last year and there's more than a 10% discrepancy when you apply for the marketplace, they can ask for more information. Now, they assume between 7 and 8 million people are going to enter this system between October 1st and March 31st. How those 7 million people get checked and balanced, I have no idea. If you look at the marketplace, the Data Hub failed a major test last week alone. It was passing out subsidies for people who should not have received them, giving some people too much money, some people not enough money. So they got about 5 days to fix it. It goes live on Tuesday, October 1st. But for large employers, you are going to be saddled with filling out these forms. And it's not just like an easy IRS form like a W-2 or W-4. This one is extensive. Everything underlined represents something pretty hefty that you're going to have to do. You have to certify whether you offer employees coverage, all full-time employees coverage. And I don't know what the question is when it comes to certification. I don't know if there's proof behind that certification, or again, if it's just you saying, yes, I promise I offer health insurance to everyone. You have to tell them what opportunity did you give to enroll these employees. And again, is there a checklist of I went down the list, I had an open enrollment period for 30 days, and I can attest to that somehow. What is your waiting period? What is your monthly premium for the lowest cost plan that you offer? What share did the employer have to pay of the total cost? Tell me the number of full-time employees you have by month. And finally, every full-time employee that you have during the year, you must provide their name, address, and social security number to the IRS on a form. So record keeping is going to be extremely important, especially if you have high turnover. Yes, ma'am.
Is that included on your spreadsheet? Are you going to have it for the eligible dependents up to the age of 26, their social security numbers, even if they're not on your plan?
The information I have right now is up only employee, only full-time employee. They don't ask for, the only time they ask for dependent questions is if you certify that you offer dependent coverage in the plan. But right now I don't see a checklist of saying the dependent is definitely on my plan or not. It's just, yes, you offered it to dependents as well as employees. Now, I will tell you that when it comes to quoting, you guys are going to have to do a lot more work on your censuses because now you're going to have the employees' date of birth, sex. You're also going to have the spouse, date of birth, sex, and the dependent's age too, date of birth. If they have more than 3 dependents, you have to tell me I have to ask you to give me the 3 oldest dependents in your family. So your census are going to have to get a lot more detailed in order to get really good rates out of the insurance companies. Your CPA should be able to help you with these forms when they come out and live. And again, this is a check and balance to make sure that if you reported to the federal government that you offer a minimum value plan to all your full-time employees and you did it correctly, then if they go to the marketplace and try to obtain a subsidy, they're going to be flagged. Their social security number is going to be flagged and they will not be able to receive one of the subsidies. And you guys know that you're caught because one of your employees actually went into the marketplace and either received a subsidy, and that's how you will be, again, check and balance and notified. If you are caught and penalized, you will be fined 1/12 of the $2,000 or $3,000 per month. So you will pay about $167 per employee that you'll be fined. That's an excise tax you'll be given every month. And people always ask me, like, will they just send me a bill? We don't know yet. We have no idea how they will get that information to you. Some of the earliest information of the IRS is that there will be a system in place, generally a 30-day reporting system, that you, the large employer, will have to say, I did offer Joe Blow credible coverage at an affordable rate. He did not take it. Here is a decline form. And then they have 30 days to respond as well. But in the meantime, you're still going to be paying your $167 of tax every month. Because there will be so many large employers who, at least in the beginning, don't understand, don't do it right, maybe made a mistake, expect this to be a fairly painful process, at least for the first 12 months or so, while they get everything ironed out.
Okay, so on that family, that's only for the number of employees that receive premium credits, or is it one employee will impact 100 that I have on staff?
Do you offer coverage or not?
Yes.
Okay, you offer affordable coverage at a minimum value. Okay, tell me the question again.
Okay. Let's presume for conversation piece that I'm in the first box, that I do not offer coverage and I'm fully at risk.
Okay,
Or no, let's go to the right side, I'm sorry. And one employee goes to the exchange and gets a premium credit. The way I read the rule, it's assessed on every employee minus the 30, not just the one that got the credit.
you got it backwards. The $3,000 unaffordable coverage penalty is for anyone who assesses the marketplace, receives a subsidy, minus the first 30. Only those who access the marketplace and receive a subsidy. The $2,000 penalty is for every employee that you have, minus the first 30.
The 2,000 is not offered at all.
Correct. 2,000 if you don't offer at all. But the 3,000 is for those who access the marketplace. And we're going to talk about MEC plans here in just a minute. And this is one of the things that a lot of the larger employers are looking at as an option. So everyone knows about the marketplace. It opens on Tuesday. We're all very excited about the marketplace when it opens. I want to show you some information that I received this morning about the marketplace, just to give you an idea of what some of your employees might be leaving you for and going to. This is an example of what marketplace will actually have. And we all know the basics of the marketplace. It's like a online enrollment tool. You guys know the basic stuff. So one of the things I wanted to make sure to point out is that in the state of Texas, Blue Cross Blue Shield will be the carrier in every county that we have. We will break up the state of Texas into 27 rating zones, and your employees will be funneled into one of those, not for large group purposes, but for individual marketplace purposes, if your employees come to the marketplace. Your employees think that they're going to get this really fantastic free health insurance, and that's just not what's going to happen. What's going to happen is that the benefits are going to look something like this. You're going to offer always a bronze plan and mostly a silver or gold plan, depending on where you are in the state. These are examples with averages based on what's going to happen in Texas. So if you look at deductible, the lowest deductible available to them is $1,500, the highest is $5,000 in the silver plan. The bronze plan deductible is $2,000 and the highest is $6,350. Remember how I told you you're going to get really creative when it comes to your insurance and how you really meet that 60% minimum value. The marketplace is doing the exact same thing. What's even more troubling than these deductible amounts is look at the pharmacy co-insurance. Notice I didn't say pharmacy copay. Right now, we are used to copays, $4 at Walmart when we go to get our generic prescriptions. Those days are gone. What you're going to see instead on these marketplace plans is pharmacy co-insurance. That means that everyone has to pay a part of their pharmacy benefits. Now, for the most part, they're in tier 3 and tier 4, but I have seen tier 1 and 2, and normally we call that generic, name brand, non-formulary, formulary, those kind of terms. We're going to tier them now. Humana's already doing some tiering, so we are used to that terminology. But now you're going to pay 10% of your drugs, or maybe 50 to 60% of your drugs in the higher tiers. That is not free insurance. That is probably going to be more expensive than what you offer on your group plan altogether. Now, I highly suspect that many large employer plans will also see some very high copayments on their drug card. If you're self-funded, you have complete control of that. If you're a fully insured large group, you may not have as much control as you think, but you will absolutely have more control than marketplace or small employer plans. You're not going to be able to move some of the small employer benefits around as much as you will in the large group arena. Look at the primary care visits. Now here we do see co-payments, but the lowest one is $5 in the silver plan, and it goes all the way up to $60 for a primary care doctor. So your pediatricians, your OB, your internist, all those are going to cost people a lot of money out of their pocket. Now, as you know, all of these costs go towards the maximum out of pocket, which will be $6,350 for a single, $12,700 for a family. But in some plan designs, and even a design you may come up with on your own, you're going to see large group employers have a $6,350 deductible, 100% plan, not one benefit is paid until you reach your deductible. That would be a 60% bronze plan. That means every co-payment is gone. Cost sharing is non-existent when it comes to preventive care, which is fine, you can build that in your plans. But drugs won't be paid until you reach that deductible. I see many large employers, again, not canceling coverage, but going to this type of arrangement. So thanks for humoring me and looking at that. I just got it this morning. I thought it was awfully interesting to see what some of these plan designs actually look like inside the marketplace. You will probably have only 2 choices of marketplace here in Amarillo, maybe 3. Blue Cross will absolutely be one of them. There's information on the Shop Exchange too for some of you who may want to be interested in that. If you're going to go back to being a small employer, it's in your packet. We all know now about the penalties assessed to your employees who simply don't want your health insurance. I have some good news though about participation. A lot of us were very worried about what participation looked like for large employers. There will be no participation or contribution guidelines for large employers. That means if you have 200 employees and only 50 of them want your health insurance, you're still going to get it. The insurance company is not going to turn you down in the fully insured world. Now, in the self-funded world, they absolutely could. But here's the kicker. If you have 200 employees and only 50 of them sign up, the insurance company will re-rate your case. They will put a factor on there because you are not meeting participation, so it's going to cost you more. So while they don't require it, they're going to highly encourage it through your checks, through your pocketbook. They're going to want you to make sure to have that level of participation, 75%-ish, to keep the cost low. Questions about that? So some of the subsidies for your employees, if you choose not to offer health insurance or you don't want to offer affordable health insurance, look something like this. Now, some of these numbers have been updated in the last week, and the slide isn't quite up to date. So the single is over 45,000 now. But this gives you a pretty good idea of where you and what you pay employees in your company. So if you're a family of 5 and you make anywhere less than $35,900, you can receive Medicaid. On up to $108,000 for a family of 5, you would receive then a tax credit, an immediate tax credit, and then pay about $855 a month in health insurance for your family of 5. Still probably a better deal financially than purchasing insurance from an employer, which I've seen plenty of dependent family cost upwards of $2,000 in our state. but the benefit is really the one that concerns me greatly. What kind of benefits are you getting in a silver plan? How much insurance are you really getting is really what's coming home to me now that some of these plans, prices, and carriers are being rolled out. There's some hanging chads I want to make sure I mention to you, and there's a lot of updates in this area. The first one is discrimination testing, section 105H that I mentioned earlier when someone asked the question. It has not been published yet. I have seen a draft copy of it, but it was horrible. And every attorney in Washington, D.C. is fighting about these testing requirements. Most of you discriminate in your health plan today. You don't realize it, you don't call it discrimination, but you do something for one class of employees that you may not do for another. That could include paying more contributions, that could include providing a better benefit plan, benefit offering. Once 105H comes out, and it was promised in December of 2012, we are going to have a time frame we're all going to have to meet and comply. And how long that time frame is, I have no idea. But for some of you, this will be a severe issue. For some of you, you carve out employees right now, and it's a severe carve out, where you may own a chain of hotels and you only offer coverage to managers but no one else. That will not be allowed after Section 125 or Section 105 comes out, I guarantee you. Now, you can pay a penalty for not offering those people health insurance. That's fine. That would be a $3,000 penalty. But you would still be assessed that penalty if you didn't offer it to, say, the hourly employees. The next concept I want to mention to you is the HRA, FSA, and Section 125. This came out on Friday the 13th, and it is severe. It is probably the most severe regulation I have seen out of the IRS since we started all this business. And it simply says this: many of you large employers are really, really smart. And what you wanted to do is you wanted to not offer health insurance at all, pay the $2,000 penalty because you knew that was cheaper than offering health insurance. And you were going to give your employees a little bit of money because you wanted them to stay working for you. You were going to do that through an HRA, which is a tax advantage program. The IRS said on Friday the 13th, absolutely not, you may not do that. Many of you large employers were also saying, well, I know I have a very poor population of employees. I pay them minimum wage or just above that. And I want to give them money in an HRA to go to the marketplace and receive the federal tax subsidy plus my money. It would be very advantageous. They would still get health insurance. You're not allowed to do that either. So you may not use tax advantage money in any method that I have thought about in order to get your employees a subsidized plan or a plan on the individual market. It cannot happen. Now, there are people who still say you can do it. There's one company in particular that says, oh yeah, you can still do it. The IRS guidance wasn't that severe. And I want to make sure I arm you with enough information so that when people come and ask you to set up an HRA and fund your employee premiums, that you know what that is. It's a Department of Labor, the guidance is 2013-13. And I have a copy of it in case you want to look at it. But I would say at this point, the penalties are severe. The concept for offering an HRA for large employers, also not a good idea for you guys to do. The other thing I got a lot of information on just this morning is DOMO, which is the Defense of Marriage Act. One of the things I would love all of you to do is go home and make a few definitions of what you consider marriage is. And forgive me, I have to use some notes because I just got this morning. But I would love for you to go home and define what you think a spouse is. If your definition of a spouse is a same-sex spouse, that's okay. Texas, if you're fully insured, Texas does not recognize same-sex spouses. So if you have a certificate of insurance in Texas, you're okay. You don't have to offer same-sex partners benefits. Now, if you have a certificate of insurance for a company you own in California or Massachusetts or Washington, you may have a different answer than what we do in Texas. It would require legislation in order for Texans to offer same-sex benefits as a minimum offering like the other states had to do as well. I do not see that happening in our Texas Capitol in the next legislative session, but I could be wrong. But if you define what a spouse is in your employee handbook, you're going to be in pretty good shape. Don't let the courts do that for you. You go ahead and put that in your employee handbook. If you allow same-sex partners to come on your health plan, which is permissive, you need to think about a few things. HSAs, for instance. HSAs actually use a different tax law to hold that money, that HSA money. A same-sex partner does not get to use any of that HSA money on their medical claims or benefits. It's not in that tax law. So if you're offering HSA and you also want to offer same-sex benefits, you need to realize that that HR money doesn't transfer over, and there's nothing you can do at this point to make sure it transfers over. Also, you don't want to just address the medical benefits. You want to think about things like dental, vision, life, disability as well, if you're going to incorporate that in your employee handbooks. And finally, it applies to you. If you have a self-funded plan, it absolutely applies to you. You need to address this. Although I will tell you again, if you're fully insured and your certificate of insurance is in Texas, you really don't need to do anything. But I would, as an extra step, define what you consider a spouse is in your employee handbooks, because some of you will be asked. Finally, ERISA 510 is something that the lawyers are starting to circle the drain and really get excited about. If one of your strategies has been to reduce work hours to 29 or less because you know you don't have to offer part-time employees benefits, and you're never taxed, fined, or penalized for employees, you've already done that. Many companies have already done that, by the way, because they didn't know what was going to happen on July 2nd was going to happen. So they were already reducing work hours. Well, there's a little provision in ERISA called 510 that with a class action lawsuit, anyone whose work hours were reduced because of health reform, they could actually sue you. So if you have already done that, I hope you did not tell them it was because of Obamacare. I hope that any changes you have made in your health plan, you have not put a big flag out there saying it's because of Obamacare. Because that's where many employers are starting to get in trouble, and lawyers love it. I sat on a panel on Tuesday with an employment attorney, and he was handing out business cards because he was ready to sue somebody when it came to ERISA 510. Nobody knows about this ERISA provision. It's obscure. But the attorneys absolutely have caught on to it, and they're ready to sue somebody. So there's some questions for your company that I'm sure you have already asked yourselves, because as large employers with a lot of money on the line for 2014, you are working through these processes already. Number one, do you have a qualified broker? And if NCW is your broker, you're in very good hands. Excellent hands. I get to see brokers all across the state of Texas, and I've never seen a broker take care of their clients like they do for you guys. It's a pretty amazing process to watch. The next thing I want to beg you to do is not wait until 2014 in the fourth quarter to make some decisions about your health plan. Now, I am not saying rush out and change everything on January 1st. I'm not saying that at all, because if there's one thing I do know, is that the federal government changes their mind a lot. But I would put some serious effort into this starting the summer of 2014. Devise a plan. What are you going to do? Talk to your carriers. Ask them what are their plans. How are they going to help you manage? If your carrier doesn't have a good idea, you might want to get a new carrier. I know it's painful to move health insurance, but if you're not going to get any support from your carrier, find someone who will support you. There's a lot of options and creativity out there. Also, I would expect a few more delays and changes. I don't see everything running as smoothly as we all kind of hope, or that the White House is telling us that it might. President Obama this morning put out a happy video for all of us to watch on healthcare.gov that really says that everything's running smoothly, everything's fine, this is a great thing for our country. So you can go tune into that if you get bored later. You might want to talk about, do you want to pay or play? Are you going to pay the penalty, or are you going to provide proper benefits for your employees? And before you jump to the I'm going to pay the penalty box, you might want to actually look at what some of these minimum value plans cost. There are some very creative ways to really funnel down costs when it comes to large employer plans. You need to think about your look-back period and your measurement period and really determine how long of a measurement period do I need. And if you use this year's data, it might give you a good snapshot into the next year. Unless your hiring practices really have significantly changed or your business model has changed. So some of the things I see larger businesses doing in Texas are all or some of these. I see some of them saying, I'm going to pay the $2,000 penalty. Not very many at all are saying that today. Some are saying, I'm going to keep what I got and pay the $3,000 penalty on anyone who goes to the marketplace. I'm going to take a chance. Because if they don't qualify for a marketplace plan, they don't know how to do it, they never enroll, then I might skate off not paying any $3,000 penalties. It just depends. I see a lot of reduction of work hours. That is probably the number one thing I see to get out of health reform. There's a factory in El Paso that actually added a shift and made everyone work 29 hours a week or more. They actually instituted a policy that if someone worked over 30 hours a week, they would write them up. So I see a lot of that going on. MEC plans, minimum essential coverage plans, fairly new concept. We were calling it skinny plans about 2 months ago, but now we're calling it MEC. I don't know why, because we have to have the acronym for everything. Be cautious when you have a MEC plan. A minimum essential coverage plan would only, most of the time, only cover preventive care and maybe a handful of doctor's visits. It does not get you out of the $3,000 penalty, but remember, that penalty is a gamble. It's not assessed on all of your employees, only assessed on the ones who go to the marketplace and receive a subsidy. So for some of you who have employees who say, I don't want your insurance, I don't need your insurance, I don't like your insurance, I'm never going to enroll in it unless you pay for all of it, a MEC plan might be good for you. You put in a MEC plan that costs about $50-ish a month per employee. They sign up for that. Then you build on your bronze, silver, gold, and platinum plans on top of that, make them buy up for those people who want to buy that insurance. Now, I would caution you because the feds are going to catch on to this MEC concept pretty soon. There's already grumblings about it, but they're just trying to get this exchange or marketplace running and up and going right now. And they're going to worry about the MEC later on. But you are going to see a lot of concepts, a lot of companies come out with it. The most popular one so far I've seen is self-funded, and it is cheap. It is super cheap. So keep your eye out for that. I see a lot of self-funding happening for large employers, and I will caution you, if you have more than 50 employees and you're going to go self-funded, you need to know what you're doing. You need to understand terms like lasers, aggregates. You need to know what network you're purchasing and how much administrative costs are being built in. There's a lot of moving parts when it comes to self-funding. It is not as easy for you big guys as it is for the smaller plans. Smaller self-funded plans have a lot of safety nets built in, even return on premium. You guys got none of that. You are going to be fully insured. You can be turned down self-funded. You can get very creative on your self-funded plan, but it does require a lot more expertise in order to make sure those self-fundings work. I see no more spouse coverage, mainly from the mega employers, the big boys, American Airlines, UPS, FedEx, all of those big guys are certainly considering that as an option. And then I also see, as of the last 2 weeks, some significant change in retiree coverage. The big guys offer pretty good retiree benefits, and I am seeing those plans fall like dominoes. So if you happen to be enjoying a retiree program from IBM or American Airlines or one of the big guys, use caution, because I think that those are going to change. Change so much that they might dump you into the marketplace instead of offering insurance for you altogether. Haven't seen anything as that severe yet, but I wouldn't put it past a larger company at this point. Retirees are bleeding them dry. So there's a bunch of reference material. I would say that if there's one place that you would want to post in your break room for your employees who may have questions, is healthcare.gov. It's written on a 5th grade level. It's pretty easy to understand, a lot of big pictures, big buttons. It's available in English and Spanish with a click of a button. It also has a live chat feature on it. So if your employees still do not want your health insurance, but they may be asking you where they can get it in the meantime, that's where they would want to go, healthcare.gov. Now remember that if you offer today a minimum value affordable plan, you still block your employees from receiving a subsidy from the marketplace next year. But if you do not offer a minimum value plan at an affordable rate, they can all go into the marketplace. And then you're going to be faced with participation increases. So keep those things in mind as you kind of move through your processing about what you need to provide as a large employer, and what might be, available to you in the future. Anybody have any questions? Yes, ma'am.
The differences between the states. Being a transparent, we have several employees who have ex-wives and children from other marriages, and especially one in Oklahoma. Okay, what we get from Oklahoma, they call for court-ordered insurance, but if the cost to the employee is over $65 a month, they don't have to get it.
That's Oklahoma rule.
So is that going to change with this? I guess that's,
No, this doesn't change that. The best part of advice I can offer you on court-appointed or court-ordered coverage is if honestly, as an employer, they cannot afford the premium, I'd write the judge a letter. And I would tell the judge, this coverage is $500 a month. This person makes $7.85 an hour. I know that in Oklahoma, this child could get covered in CHIP or Medicaid. I would go the extra step and write the judge a letter and see what happens. That's getting a lot of success here in Texas, at least, with Greg Abbott.
it just so happens that with our company, they can actually all afford it. They just,
Oh, they choose not to do it?
well, like I said, Oklahoma is saying if the cost of insuring the child, putting the child onto his insurance is over $69 a month, then it's not affordable.
I have never seen a $69 child rate in about 5 years.
Oklahoma has.
Wow.
So that's what I'm saying. This affordable care, what's that going to do to Medicaid, CHIPS, and everything that all these people are on?
It's not going away, it's going to be expanded.
It's going to be expanded.
Well, we're not going to expand up to 133% of FPL. We're not going to expand our definition in Texas. What we will see is, in theory, an influx of Medicaid and CHIP recipients, because now they have to have insurance or they think they're going to be penalized on their tax return. Truth be told, there are a ton of exceptions to having to pay that $95 or 1% of your taxable income penalty, and they're pretty ridiculous, actually. One of them is if you have received a notice. I was going to try to pull it up for you guys. If you've received a notice that your utilities are going to get cut off, that's a hardship that you can apply for. Yeah, there's hardships. It's a whole page long. So people who qualify for Medicaid and CHIP at this point, they're going to understand eventually they can not apply for coverage, not pay the penalty because of a hardship that they have to apply for, and still go to the emergency room and get their care. I mean, there's loopholes in this whole law.
There's loopholes in every one of them.
Yeah.
We have several, and we pay 100% of the employees' insurance.
Yeah.
But he pays the difference for spouse or family. So the employees take the insurance, they put their wife and kids on Medicaid.
Well, if they're married, they don't. If they're married, they're not putting wife and children on
There's
there.
loopholes.
Yep. Other questions? Yes, sir.
On demonstration, testing, on length of service that an employee might have, do you think that will be an area they will look at like we?
I remember you. You were really creative back in Oklahoma.
And I have another question, but I'll let you answer that first one.
I didn't see any length of service terminology in the draft notice that I received. But I will tell you that draft that I received on discrimination testing was quickly redacted, quickly. So I have no idea what they were going to do. The initial notice, I saw no length of service.
Second question, when we were here the last time, the question was asked to you, do you think the Obamacare issue or the Affordable Health Care Act will be repealed? I remember your question, your response, I'm going to paraphrase it, was you did not believe it was because there's billions of dollars that have been pumped into this, and then for that reason, it would always, there's gonna be something that happens. Are you gonna stand behind that statement still now, or is there a possibility you might waver on that?
My answer still stands. Too much money has been pumped in the system. What I see are more delays. And if we look even further down the road, what we see is once we start getting evidence that people are not enrolling in the free health insurance, they thought it was free, and people actually start having to pay things like a 60% cost co-insurance for their drugs, they're going to get really angry. They're not just going to get angry at Republicans, they're going to get angry at Democrats as well. And so that will be the beginning of the end. When people say, I'm not going to buy health insurance, it's too expensive, it doesn't cover enough, I'm smart enough to know I'm going to pay the fine instead, and I'll go without insurance, I'll go to the emergency room. Second piece that can make Obamacare fall is what I came here and told you in spring is that the way doctors get reimbursed is a tiered system. In spring, I said it's Medicaid, CHIP, Medicare exchange. I was wrong. The way it works now, it is exchange, Medicaid, CHIP, and then finally your Medicare plans. So your doctors and hospitals are going to get very upset because they get reimbursed less than Medicaid rates. That is very important, especially for your area when you do not have an abundance of doctors or hospitals. Now, if you were in Dallas or Fort Worth or Austin, you'd be in better shape. How many of your hospitals here accept Blue Cross's HMO network? How many of them will really accept it once they find out they are reimbursed lower than Medicaid? How many of them can afford to stay in business, especially when the government thinks we're going to have an influx of 7 to 8 million people enroll in this plan? Doctors and hospitals are going to do the second giant push to get rid of this, or get more money. Yes, ma'am.
Are you saying that Blue Cross is going to pay the doctors less on an exchange product than they pay on their other products?
Yes,
They're
ma'am.
allowed to do that?
Yes, ma'am, they are.
So we will get paid less on an exchange patient than we do on a Pantex patient?
If you agree to play in the exchange, just like you would an Aetna POS plan. If you choose to accept Aetna POS, you accept that reimbursement. If you choose to accept Blue Cross Blue Shield Exchange or HMO or whatever they're going to call it, then you agree to that lower reimbursement. Yes, ma'am.
We are a physician's office and we've not been approached by any of them to accept their network.
I hear that time and time again. I hear that all the time. Yeah. So if I were you, I would call them and I would ask them, are you putting us in your network? Will I be seeing exchange patients? Tell me what my reimbursement is at that point.
Well, they can't put us in their network unless we join it.
Yeah.
Unless we sign a contract.
Right. Show me the contract. What does it look like? Do I want to be in your network? And if you're a major employer of physicians here in Amarillo, I'm sure everybody in this room wants to be in your network. And if you say no, one less choice for the employees. So when you're talking to your employees about their free marketplace health plan, make sure to tell them, who's your doctor? What hospital can you see? What are your prescription drug costs? Do you have any first dollar coverage or is it all deductible first? I don't think the marketplace is going to solve our problems just simply because of the plan design to this point. Other questions? Yes, ma'am.
Okay, we have a January 1 renewal date, and you have a cafeteria plan for your healthcare premiums and pre-tax. The open enrollment period for the exchange, how is that going to affect the open enrollment period for your healthcare plan?
There's actually a one-time exception that can be made to a Section 125 cafeteria plan. So you can allow employees to leave your health plan if you put it in your plan doc in your Section 125 just one time. So you renew January 1st. Is your Section 125 on a plan year 2 or calendar year 2?
Yes.
You don't really have an issue. So you just open it up for the 30 days prior to January 1st for open enrollment. Your Section 125 is also open. They can bail on you as long as they do it for a January 1st start date. Now, the only exception to this is if the marketplace doesn't go as smoothly as we all think it will, and there are too many glitches so your employees cannot access or get coverage by January 1st. You'll be able to tell that by about November, maybe end of October. If you see that it's running difficult, or if you see that there is just really no good options here for you guys in Amarillo, you can make that one-time Section 125 plan doc amendment and open it up, say, February or March. But remember that the marketplace closes for enrollment in March, so that's the end of it. But there is a one-time plan exception. You want to contact your plan administrator to put your plan doc together, and if you want to do that, you might want to amend your plan doc. If you don't have a January 1st renewal date as a large employer and you have a Section 125, keep that in mind. You can't just dump your Section 125 rules in order for your employees to go to marketplace. So you may have to amend your plan in order to get them into an open enrollment period. The other thing about the marketplace for large employers is that they might go this year and you're not going to have a penalty for any of that. That's fine. But when the water faucet of subsidies cuts off for them in January 1, when you renew your health plan of 2015 and you're in total compliance, they have to leave the marketplace and come back to you. So that's going to be another little blip and issue. If they were getting full subsidies for them and their entire family and they come back to you, and you just make the employee only affordable, they're going to feel like they got gypped on their families. Probably better coverage from you, but gypped nonetheless. Yes, ma'am.
I have two questions. On the exchange, does it have like qualifying events like our coverage does?
Yes, ma'am.
Not just an open enrollment, any qualifying event that you go in?
Yes, ma'am, it does.
Okay, and then the second question that I have, and we discussed this in the first session, and I just need a little bit of clarification. If you have a part-time employee who is scheduled to work 28 hours or less, he's going to school, he needs more hours, he's willing to work more hours, doesn't want insurance because he's on his dad's, because we hire a lot of 20, 21-year-olds, stay on their parents till 26. What is the risk there?
If the coverage is qualified through a parent up to age 26, that person's a waiver, and so they have qualified coverage somewhere else. Much like TRICARE, Medicare, Medicaid are waivers for you larger employers as well.
So we would want to require proof of other coverage? Same thing if I have an employee that wants to waive our coverage because she's on her spouse's, they want that to be the primary coverage.
But requiring proof is really a moot point, because I can produce an ID card for you that I had 5 years ago, and you don't know if it's valid or not. So what I prefer is an attestation. It's a checklist saying, I understand I am declining your coverage because I have coverage here. It is, I understand that I'm declining your coverage and I will not receive a subsidy for me or my dependents in a marketplace. Make them sign and initial that. I prefer that method with a signed declination on the carrier's form than I do proof of coverage. Because I can lie on proof of coverage.
Thank you.
You're welcome. Yes, sir.
Help me understand what the parameters will be for the minimum value affordable plan. I'm not sure I understand what you said.
The 2% parameter, or just the concept in general?
I determine what would be a acceptable plan.
So determine an affordable plan is you have to use that CSIO Excel spreadsheet. And you put some information in there, deductible, co-insurance, co-payments, maximum out of pocket. And that will spit out what the value of the plan is. So I have seen $5,000 deductibles and 80% co-insurance with a $3,000 out-of-pocket max hit at about 83% value of the plan. It's just a new concept. You're going to have to open up an Excel spreadsheet and just look at it today. Now your carrier will tell you eventually where your plan falls. It's just going to require a little bit more work. I wouldn't expect the carriers to roll anything out until at least mid-2014 when it comes to that. Anything else?
The question in the back.
Oh, I'm sorry, yes, ma'am.
We are self-rented, and in regards to, like you said, she has someone who's under 21 or under 26 who is on a parent. If we have employees who work 28 to 30 hours and we have to offer them insurance, is that, if it's an average of 30 hours a week?
If during your measurement period, they average out more than 30 hours a week, you must offer them health insurance. And if they're under the age of 26, they can decline, and it won't be, there's no harm to you, as long as you have in writing that they have coverage somewhere else, like they're a parent.
But if they're over 26, then we have to offer them.
You have to offer it to both classes of employees, but those people under 26 who have coverage, they're parents, they have credible coverage somewhere else.
And what about on a spouse plan? Same thing.
Correct. Yes. If you have spouse coverage somewhere else, then yes, that could be considered credible coverage.
But your spouse is not required to cover.
No, my employee chooses not to take mine, but to go on her spouse's. She waives mine because she's got her spouse's.
That's okay. You have to declare that you are not covering spouses, period, paragraph. You can't willy-nilly do this throughout the year. So if your company line is we cover no spouses, you gotta put that in your plan doc and make sure you are really doing it full force.
No, that's not what I meant. We do cover spouses, but I have an employee who says, I don't want your coverage, I want to be on my husband's. So she waives mine completely, goes with it.
Yep, she waives it in blood on a declination form, and I'm working on a checklist for our brokers, verified by an attorney, of course, that runs through these checklists, because you want to scare them, saying, I understand, I will not do this, because you all will be audited by the IRS. Of that thing, I am certain. Because one of your employees is gonna go, they're gonna try to get a subsidy, and the checks and balances aren't gonna work out. So you wanna make sure that you have declinations for everyone who declined your coverage. Yes, sir.
You commented on that attestation or declination that I'm under decline coverage. That there was some implication that I heard that you can waive, that individual can waive rights to receive a premium.
Yes.
And is that enforceable? Because I want to caution that if I hired an employee that signed this form for your job and you waive your right to go get insurance and a premium, then I have to offer insurance.
Now,
Because he's waived it. I think that's one of that creative, this gentleman here on the right was about creating this. Question, you're walking on thin ice there when you've got to waive that right.
what you do is you tell the employee in a statement, or you inform them or make them sign off saying, I decline coverage, and I understand that I was offered affordable minimum value coverage. I understand by declining this coverage, I will not be given a subsidy in the marketplace. Because you offer affordable minimum value coverage. You also go on to say that you are waiving the premium that you, as the employer, would have paid for the employee. And that's in some federal guidance. Yeah, and that's going to be on one of the checklists I'm working on for our brokers. It's just going to take a little while to get the lawyers to sign off on it. And again, that cover page, the thing I'm talking, the checklist, is not a requirement, but I think it sure is good for you to have on file. Yes, sir.
Several times you've mentioned that the IRS is going to be the people that audit us. They currently don't have enough staff to do what they should do. They don't answer their phones. Are they getting a lot more staff to do this, or how is this going to happen?
No, actually, the hiring of the 90,000 or 100,000 IRS agents is an urban legend, to be honest with you. ERISA did not hire, Department of Labor did not hire, all myth. However, the data hub is set up to have this check and balance system within it. If they can ever make the technology in the data hub work correctly, there will be some pretty easy ways, I say easy, ways for employers to get caught. And it's going to be based on your EIN number, Social Security. And what I haven't said is that, so employers have that 6055 and 6056, they're going to send it to the IRS. The employee has their 1040 that they must submit as well. Every insurance carrier must also identify their insurance and send that up as well. So we have a lot of built-in check and balance if the hub ever works as expected. Yes, ma'am.
I might say to the group, since you all are employers of people in Amarillo, that our group is in an organization that represents well over 100 doctors here in Amarillo, not just the Panhandle, but Amarillo, which includes all of family physicians, family medical center, Amarillo Medical Specialties. And we are not in an exchange program. I also know that Amarillo Diagnostic Clinic will not be in an exchange program. And so I think you all need to be aware of that if you have employees that are considering doing that. It also includes jail Wyatt, which would probably be a clinic for uninsured youth.
Thank you for sharing that. That's really important information for us to know. And I think in a lot of communities with the size that you guys are going to be faced with the same things. I think Dallas, Houston, Austin, El Paso, San Antonio are going to be fine. But everywhere else is going to be extremely spotty. I just got word today that a navigator is pulling out of the entire program in the valley. They got a federal grant of $855,000 and they're not going to be a navigator. Too many rules and regulations and not enough support from the medical community as far as doctors offering health insurance for people in the marketplace. So as we get closer to Tuesday, October 1st, and we really find out who the carriers and players are, I think we're all going to be very surprised to see about the level of benefits, the networks that are provided. Not saying doctors who participate in the exchange are bad doctors. I'm just saying when you have a group of over 100 in your community that's not going to participate, that's a pretty big red flag in my book. Any other questions? Yes, sir.
Is 26 is the dependent age right now? I assume that's just an arbitrary number that somebody chose somewhere. Is that etched in steel, or is there any rumbling that could go either way, or?
It is a minimum standard, I call it the slacker law. So you can slacker on your parents' health care till you're 26. My kids won't, but some kids will slack until they're 26. You have to meet that as a minimum value in your state. Some states, and I believe it's Massachusetts, that age is 32. I believe it's Massachusetts. You can slack it all the time. I'm moving up north. Any other questions you guys have? I am happy to stay afterwards and answer any private questions that you may want to talk about. I appreciate you coming back. I hope you stay awake. And thanks for coming.
I thought that was you.
How you doing? Oh, not much. Where you at?
These guys.